Hello and welcome to the U.S. Open Health Desk presented by Mount Sinai. I'm your host, Mal Washington, joined by Dr. James Gladstone, Chief of Sports Medicine at the Mount Sinai Health System. Dr. Gladstone, welcome. I appreciate your time.
It's always fun to be here.
You enjoying the tennis so far?
Oh, a lot. It's such an electric atmosphere out here. It couldn't be better.
Mount Sinai has been partnered with the U.S. Open for 5 years now. What are some of the things you have learned and your staff have learned about the players in the U.S. Open?
You know, besides the fact that these guys and girls are just incredibly well-tuned athletes, I mean, some of the best conditioned people I've seen anywhere in sports, it's the mental toughness of this game and the resilience it takes to really succeed.
What type of medical care does Mount Sinai provide for these elite athletes?
Well, we really run the whole gamut. We have usually about 5 doctors on site here at all times, ready to help in whatever capacity necessary. We also now have radiologists here with ultrasound and x-ray machines as needed. And this year, for the first time, we brought on an acupuncturist as well to help with the whole process of getting ready and healing.
As a doctor and as a staff, what are some of the most common things that you have to address with the athletes?
A lot of the times it's these chronic nagging injuries that they've been carrying with them throughout the course of the tour. And so they've treated it in one way or another, and is there something else they could do to really tweak it to really prime themselves for the Open?
What type of additional support is available to the players here at the Open? Because some of them will be coming into this championship with strained muscles or something ailing when they get here to New York.
The USTA has a tremendous staff of physiotherapists and massage therapists who are on site, ready to treat at all times. I think the particularly good thing with the physiotherapists is that both on the men and the women's tour, they travel with them. So a lot of the times you can gain some great insight from them in terms of what they've been dealing with, what they've been doing, and how they're feeling.
Are there things that you see the professional players doing on a daily basis to prepare for their matches that you might be able to tell to weekend warriors so they can emulate what the players are trying to do?
The biggest thing is that a professional athlete, it's their job, so they're always on. And if they're not playing, they're practicing. If they're not practicing, they're stretching, they're doing conditioning work, they're doing agility work. And I think the biggest problem with our weekend warriors is that they do something 1 or 2 days a week, and when they go out and do it, they go all out, and that's where they get hurt. So I'll often suggest and encourage them a couple of other days a week, either to go to the gym or do it on the floor of their living room, do some good stretching, especially as you get older. Flexibility is key.
Dr. Gladstone, thank you for your time and your expertise. Enjoy the U.S. Open.
Thank you. Pleasure to be here.
Don't forget to check out usopen.org for more tips from Dr. Gladstone and the staff at Mount Sinai. Until next time, this has been the U.S. Open Health Desk presented by Mount Sinai.